Good morning, Martin. Thank you for taking some time out and getting involved in our business owner podcast. Would you like to go ahead, introduce yourself, and tell us a bit about what you do?
No problem. Thank you for the invitation. Glad to be here. So I'm Martin Tierney, Managing Director of Seating Matters, and we make clinical therapeutic seating and other products in order to help caregivers provide the means to care for their patients. So we operate from Limavady in Northern Ireland as where our head office and factory is, and we have other companies that we're partnered with in different parts of the world, and we have distributors and sales in the US, Canada, Australia, New Zealand, throughout Europe, UK, and Ireland.
Awesome. And a local company then competing on the global stage. Martin, how long has the company been going, and how long have you been the managing director?
So we started the company in 2008, really, and it was to formalize something which my parents had started for a number of years before that. My mother is an occupational therapist, and she was assessing patients for equipment, and she found it a challenge to get chairs for her patients. And so my father said, "Well, maybe I could make a chair for one of your patients." And he made one, and made another, and made another. And then my brothers and I said, "Hold on a second, maybe there is more OTs out there than just our mother." So in 2008, we started Seating Matters as a company, and we started to export UK and Ireland initially, and then a further afield to those other countries as the years went by. So today it's still very much a family business, but with much larger reach today. With over 100 people working with us here in our head office. We have acquired four companies in the last number of years as well, and that's to take us into new product areas and to serve caregivers and patients in different ways with different products and different services.
Sounds. I mean, 2008 probably wasn't the best year to pick to start a business. So, what's that journey been like? From then till now. It sounds like it's been pretty exponential growth. What's it been like to be involved in that?
It's a fascinating journey. Like the driving force behind all of that is there's patients suffering and in pain every single day because I haven't done my job well enough yet. We still haven't got to every person in Northern Ireland, and we've been
Okay.
operating here for 20 years, you know. So we have so much more to do, and that's what drives us forward. And from the very start, that's what it was. We just go into a nursing home and you see someone with a pressure injury, and that just
Yeah.
should not happen. You see someone who's stuck in hospital and can't discharge from the hospital in time because they haven't got the correct equipment, and that just should not happen. So yeah, there's a very big need for what we have, and we've got a big job ahead of us to fulfill that need.
And just out of curiosity, then, I get the sense that if I asked anybody in the company, they would have the same view that there's a lot of work to do.
Mhm.
Is everybody working towards that same why and that same purpose?
Yeah, so we've got a vivid vision for the company, and it's where we're going to over a 3 year period with a 10-year moonshot goal. And we're about two-thirds of the way into that initial vivid vision document, but we talk about that document wide and far. We share it with our colleagues, with our suppliers, with our customers, uh, to let people know where we're going and why we're doing this. And it's something which really unifies the team
Yeah.
behind the team. So yeah, that's a huge part of it, getting the whole team to work together because it's not much of a business at night time, when everyone has gone home. So
Yeah.
it's the brilliant colleagues that we have is that brings the company to the stage that it's at.
Awesome. And what would you say has been what have what's been the biggest learning you've had about yourself, or is there something you've had to learn the hard way in that journey?
Oh, so much, yeah. 100 different things. I suppose when you start a business from scratch, as a family, we just did a little bit of everything.
Yeah.
And, we were getting regulatory things sorted out as well as doing design, as well as doing sales, as well as doing manufacturing. But, as things move on and we've scaled up to where we are, I think it's really about finding your unique ability and what I as an individual am particularly good at and particularly interested in. And there's lots of things that I don't do anymore because there's other people that are much better at it than me. There's other people who really enjoy doing those things.
Yep.
And streamlined my work to what I'm good at and what I enjoy and what customers are happy for me to do on their behalf.
And
So
was there any was I was going to ask, was there any trepidation or fear around giving that other stuff away?
there is for sure, and that's the growing pains of that lots of people will be familiar with. That letting go.
Mm,
That if I do it, I know it'll be done the way I want it to be done, and it's
yes.
much faster if I just take the next 60 minutes and I do that job myself. And it's a
Yes.
slower, more deliberate thing to say, you know what, let's take 120 minutes and train somebody else on how to do it. And then
Yes.
let's check in with them once a week for half an hour for the next 6 weeks to make sure that they really understood it. And then I don't have to do that any longer, you
Yes.
know?
So you're investing
Um,
your 120 minutes at the start.
Absolutely, absolutely. And my father used to talk about the man cutting the trees, and he was out and the sweat's lashing off him, and he's saying, I have to get these trees cut. And the observer looks at him and says, "Well, would you not sharpen that saw?" And he says, "Well, I haven't really got time to because I have to cut these trees."
Yes. Yes. Yeah. When you put it like that.
So, so something that I've tried to do, I suppose, is to pass along things to people that are better qualified than me to do it, and to let go of that, and that can be hard, but it's what growth is, and to a large extent.
And along the journey, then, is there any, I'm sure there were some. It's been a bit of a roller coaster. And is there any quotes or sayings that you've leaned on along the way that have really helped you?
Yeah, well, it always comes back to the patient from our point of view, like I remember the first assessment that I ever did, the first patient that I ever went to see in a chair. And the man had dementia and he had hearing difficulties. And myself and a therapist and a nurse and his sister were all there in the room, and we were trying to sort this man out. And we were kind of having a discussion among the four of us about what would be best for him.
Mm,
And he slapped the table and he says, "I'm not stupid," he says. "No one has asked me." And it was like a dagger through the heart. It's like, oh my goodness, we're all here trying to do what we think's best, and we've ignored the most important person in the room, who's the patient. And that really stuck with me forevermore. Every other person I went to see, and it's getting down and looking into the guy's eyes and saying, like, what can we do for you? And there's a human being with a long history behind every chair that we make in this
yeah,
factory. People that have long and successful careers or had their own families or had traveled the world, and now they're an older person with a disability. They're no less a human, they're just not as able as they used to be. And it's really an honor to be able to help people like that. It's a pleasure to be able to do that.
yeah. Really, I mean, it really comes across talking to you that you couldn't. You're the epitome of customer centric or putting the customer first. I mean, every move you guys make seems to be for the patient who's going to avail of your product and use your chair.
Absolutely, absolutely. Like, we don't talk about our production target here. We talk about how many life-changing products can we create today.
Yeah, yeah,
That's what our target.
yeah. It puts a
So we're
different spin
making.
on it.
Absolutely. How many life-changing products are we going to make today? And we have a picture of one of the patients and one of the caregivers on our morning meeting when we're talking about the production goal.
Yeah,
And it's really humanizes it. And what we do is everyone in our factory has been to the local care homes to visit the residents who are using our products. And we've brought the local care home here on a visit where people come around and see how our products are made, so that there's a real deep connection between someone who's designing a new mechanism and the person that is now able to eat their lunch because that mechanism is working for them.
yeah,
It's so, so important. And I think that's something we try very hard to hold on to as we've grown, because we're now a much bigger professional international
sure.
business. But that human or that family feel is something that we really feel very strongly about. And as new people join us, we had three new team members here yesterday that are joining the team. The first thing we do is sit down with them and talk about the patients, and look at this lady that we were able to help. Look at this child that we were able to help their mother, get that child to school in a better way. And that human connection is what's so, so important. And it's what's missing, unfortunately, from our industry a lot of times that we try and keep front and center.
And it's and again, it's such a powerful thing. Do you know? I mean, it puts a totally different spin on production if it's a life changing product. I mean, I can see, and even just having the picture up, I can imagine, having that front of mind, is very powerful. If you think back over the last 20 years since you've been in business, what is there one thing you can say was the biggest attributor to your success? Is there one thing you could pinpoint that you would, if you had to do it again, you would definitely do that one thing?
Well, it'd be hard to think in one particular thing. I think, we talk about our principles and our values in here.
Mm,
So when we bring someone into the company, we think about our DNA, and that's driven by growth,
yeah.
never giving up, and having a servant's heart.
Okay.
That's the type of person that we're looking for to join the company. So if they're not driven by growth, they're probably not a good fit for here because we want, to help so many people that we need to grow in order to do it.
Sure.
That's a very difficult job to do. So never giving up is a quality that's really important to us. And having a servant's heart, like a nurse working in intensive care, who is intelligent, caring person who will stay 30 or 60 minutes beyond the end of her shift in order
Sure.
to help her because she really cares, she really wants to serve that patient. That's the kind of person that we're looking for.
Okay.
And then when people are in here, we train on the principles. And our principles are something that are trained and spoken about every single day in here. So our principles are, like, for example, respect for people, to invest for the long term. Those are two of our principles. Um, uh, we have one which is to grow and develop exceptional people. So more than any single thing, I would say the continuous repetition and training and focus and emphasis on our DNA and principles is the thing that has made us stand out and that has brought us this far. Because if we try and set out so many rules or so many regulations,
Yeah.
you'll never have enough rules and regulations to fit everything. But our 10 principles um, guide every decision that we make. And I'd say that is that's the biggest factor in getting to where we've got to.
Yeah. No, and again, I think it's people fall into the trap of thinking that that's fluffy stuff, and vision, mission, culture, that's for a different business. But it's such powerful stuff. It allows people to get enrolled and inspired and building something bigger. So that's very cool. I always like to finish up on this question, Martin. If you could go back in time and speak to, well, let's say speak to Martin in 2008, what piece of advice would you give him, if you could go back and speak to him now?
Yeah. I would say, you'll figure it out.
Yeah.
There'll be plenty of challenges along the way. You'll do 100 things wrong, but you'll be able to figure it out. Just keep going. And again, back to the patient, that's why a compelling why is so important, a compelling purpose, or for us, it's being able to serve that patient. If we really believe in serving that patient, you'll figure out whatever the problem is.
Yeah.
So I would say that's what it is. And uh, keep that why front and center. Have the picture of that person as the screensaver in your phone and think about them every day because whatever problem we're dealing with is not as big as the person who's suffering and in pain because we haven't done our job yet.
Yeah, no, that makes sense. Look, Martin, really enjoyed that. And again, I can tell the passion you have for the journey you're on really comes across, and I appreciate you coming on and sharing it with us. And I can't wait to share it with our community. So thank you again for getting involved.
Okay, thank you very much.